Okay, so the problem here is that we have this toe here, which has had some trauma, or, the toe was stubbed some time ago. So the toe became swollen and it healed like this. And you can see when you look at the second toe that the bulb of the third toe is much bigger than the bulb of the second toe. And this one should be bigger than this one actually, usually. So that's the problem, is the toe is swollen, so it starts to hurt along the tendon here, and it hurts on top, because the whole toe is swollen, and then the other toes are like, pinching it there, so it makes the toe hurt when it moves and whatnot. So what we need to do is we need to get rid of the swelling in the toe, and this is considered an end organ, which means blood comes in, it has to go 360 degrees around and then go out. So in end organs, it's very difficult to get rid of swelling. So end organs like your fingers, your kidney, your eyes, they tend to get congested is the word. So now the way to get it out of the toe is to very gently, you don't want to tourniquet this toe with tape or something, is to use a very gentle material like this, which is, I like Coban, which is a 3M product. So you make one piece that's maybe like 2 inches long, like about the size of your index finger long, and then you put it like this, just around the bottom of the toe, and then around the top of the toe like this. Just smooth it down, like that. And then we're going to put like anchoring tape, but we're not going to pull it really tight, because remember, we don't want to tourniquet the toe. We're just gently giving just a little bit of compression on it. And we start at the top and then just work our way around like this. But don't pull it, just pretty much laying it down, you see? And it's kind of like sticking on the top, but that's fine, because you can just push it down like that, because this is self-adhesive. You see, I'm not pulling, I'm just laying it down like that, starting at the top of the toe and then working my way down. It's easier for me to do it on a patient than it is for a patient to do it on yourself. But what will happen is that as you keep doing it, you'll get better at it too. And I'm going to use another little piece. This might be enough. You could try that, or maybe another little piece so it doesn't start falling apart at the base. Just be careful not to pull it tight. And just laying it on very gently. So I use two pieces of tape for the anchor, which are each about 3 inches long. So the one that goes here is like 2 inches long, and then the anchors are like 3 inches long. Here's an extra anchor piece I made. So maybe that's like 4 inches long, I would say. So a 2-inch piece, that's half of this, and then a 4-inch piece. That's how you do it. See, and there he is like that. He's got this little bandage on.
Do you tape it?
Nope, this is it. And I'll trim this little tag a little bit, because you don't need all this extra material. So there he is. Look, he's a little happy little bandaged toe. And it has to be bandaged like this for several weeks, because it's going to take, it's so gentle. It's better to do it over a long period of time, very gently, than to think you could like tourniquet this and get rid of the swelling quickly. That won't work. If the toe hurts, you have to take the bandage off. That means you did it too tight. So luckily pain will tell you. This is a very healthy patient. She has very good circulation. But if you have poor circulation, you should be very careful about not bandaging this too tight. Just very, very gentle bandaging. And this really works. There's no surgical procedure to get rid of swelling in a toe. Surgery actually makes a toe more swollen. This is really the only way you can treat a chronically swollen toe, is with mild, gentle compression, and to do it relentlessly for weeks and weeks until the swelling goes away. And then just be careful, very careful not to wear any tight shoes. It's difficult to wear high heel shoes because the toe will slide down and hit the edge of the toe box. So just wearing, and the patient you can see is wearing sneakers there. Those are the perfect shoes. They're ugly, but minimizing the use of dressy shoes.
They're not actually
helps.
ugly.
No, you know what I mean. Like they're not dress. They're not business shoes.
Oh yes, they're not fancy, but
Yeah.